Okay. Good afternoon, everyone. We are joined with Dr. Colquitt today. So he is coming here to tell us all about the 20th anniversary of the African American Health Fair happening at the Foundation for a Healthy St. Pete on April 18th in St. Petersburg, Florida. We're excited to talk about this because, as we know, there are many health disparities in our community. So, welcome, Dr. Colquitt.
Thank you. Thank you for having me.
So, can you tell the audience a little bit about yourself and how did you get into healthcare and what is your role?
Okay. Again, Charlie Colquitt. I'm a pharmacist, clinical pharmacist. I work for Florida A&M University, College of Pharmacy, Institute of Public Health, where I'm a full professor. Currently, right now, I train 6-year PharmD students at MCR, which is Manatee County Rural Health in Bradenton. Been working in the community a long time, obviously with the foundation, the Minority Health Coalition of Pinellas for over 20 years. So I'm really excited about the work that we're doing and the event that's coming up.
Okay, so this is not a question I want to ask you, but I do want to ask you this because I'm a mom and
Yes.
I wanted to ask you, how could a student that's interested in pharmacy, could they get in touch with you after the show?
Yeah, we have our website, we have our email, and if you go to our website, www.mhcpinellas.com, you can send us an email, contact us, and we'll be glad to have your either daughters or sons. We'll have plenty of activities for them to volunteer.
All right. So the first question I wanted to ask you, so
Yes.
over the past 20 years, how has the African American health form remained rooted in the community while addressing major health challenges?
Yeah, I mean, it's so many things, so many challenges in the African American community. This is something that is passionate. It's part of our mission to eliminate health disparities. As you well know, health disparities is an issue with people of color in black people of color, black neighborhoods. So hypertension, diabetes, high cholesterol, high incidence of stroke, not getting your routine tests, going to the doctor, mammogram, prostate. All of these things affect the African American community at a higher rate. So we have providers, all providers of color that are part of our organization that are passionate about reducing health disparities.
So you'll have all types of health providers, from eye doctors to kidney doctors to pharmacists to everything.
Yes, that's one thing about our organization that we are very proud of. We have primary care providers. We also have specialists from the skin. I say the head to the feet, from ophthalmologists. This is part of our screening that we'll be doing. Vision, glaucoma, kidney specialists, GI specialists, dental, dermatology, doing skin screenings. So we have a lot of different screenings, a lot of activities. So please come out, bring your loved ones if they haven't been to the doctor, or if you just need to come out and get the latest information, please come out.
Okay, so one of the things is rising well through health systems change. What does system change look like in practice when addressing health disparities?
Okay, systems change is a concept that is evolving, and how we have implemented system change in our event, in our organization, is I'll give you an example. So previously, if you come out to the African American Health Forum, you'll be able to do the screenings. You'll be seen by a practitioner, and then from there, it's like, where do you go, right? Do you have a doctor, or you don't have a doctor? Well, with a system change, it's called a upward stream approach.
Okay.
So you as an organization, you ask yourself, well, what do we do beyond that screening?
Right.
Can we overcome some of the barriers, the social determinants of health? So at the African American Health Forum, we will have a system. We call them circles of change.
Okay.
And it's a concept that we're setting up a little different at the location of the African American Health Forum will be at the foundation of Healthy St. Petersburg on 34th Street South.
Mhm.
And when I say access to care, so Evra Health is an organization, primary care, and you're able to see doctors. They see, if you have any type of ailments or sicknesses or things like that, if you just want preventive health, well, they will be in one area. So you'll get your screening, blood pressure, your BMI, which determines if you're obese. They will have depression screenings. So all of these dental, we're doing fluoride treatments, dental screenings. So Evra Health is providing that in one little circular area in the back of the room, where we're having the event.
Okay.
So as you're getting your screening, we'll also have providers there to do consultation as soon as you're finished with your screening. And then if you're out of range, now you have an organization that is providing you, like, hey, do you have a doctor? No, I don't have a doctor. You can have access to that organization. We also have Baycare in another circle. So Baycare will be there providing glucose, blood sugar screenings,
Mhm.
and cholesterol screenings. So you have access to healthcare, and that's a barrier.
It is.
So we are eliminating, as an organization, we're eliminating that barrier, and that's a systems change approach. Not only are you getting your screening, but we're also providing access to healthcare.
That's awesome. So yesterday I was talking to my sister who's in healthcare about
Yes.
the rising cost of healthcare. So will you have someone there to represent or break down how they can afford healthcare, especially the people in the gap? So the gap is when you retire, and then when you get affordable healthcare, when you're eligible for affordable healthcare. So will you have people there that are able to help them with affordable healthcare or guide them to where they could go to affordable healthcare?
Yeah, one of the things our organization, Minority Health Coalition of Pinellas, we have awesome partners. The foundation where we actually are having the event is a partner. Orlando Health is a partner. Evra Health is a partner. One thing that is superb about Evra Health is that for individuals that may not have health care, or they can't afford premium health care, then they provide services on a income basis. So not everybody pays the same price. So based on your income, you bring in your financial paperwork, then your doctor visit may be $10, $20, based on your income.
Wow.
It's on a spreadsheet like that.
Right.
So that's affordable. We will have vendors. One of our vendors will be the St. Petersburg Free Clinic. So even if you can get to the doctor and get seen and they give you a prescription, well, you take it to a pharmacy, yes, it's very expensive. Well, we will have the St. Petersburg Free Clinic there, and they provide services for individuals that cannot afford their medications.
Wow.
Yes.
That's amazing. And especially people that are stricken with just disease processes and they get these diagnoses and they don't know. And it's so important for everybody to be there to get the navigation that you need if you have a diagnosis, because they'll have live screenings and everything. So,
yes.
And based on your perspective, what seems to be some of the major health disparities in our community, health challenges?
One of the health challenges is that as a community, we don't trust easily. We don't trust just with the history that has happened to African American people of color in the past. So it's very hard and that's a barrier, is going to the doctor, trusting that doctor. So one thing that is great about the Minority Health Coalition of Pinellas, these are all physicians of color. A disparity can be, hey, I want to see a female doctor, or a male may say, I want to see a male doctor. So we have females in primary care, we have males in primary care, we have specialists all through, like I said, from the head to the feet. And one thing that is good about coming out to the African American Health Forum is that they will be visible. Like if you have questions, we will have side chats. So all of these doctors will be here for you to ask any question, and we're reducing that barrier. We're eliminating that barrier. Yes.
That is awesome. I was at an event. This is a true story, and I found my dad some extra health care because he's like 75.
Yeah.
And I found him some extra health care for like $23, and he even has money coming in every month, like for food. So there's going to be so much information, y'all, to come out and get from these different providers, different programs, different organizations. So another question that I have for you was, can you share some examples of how partnerships with healthcare provider, policymakers, or community organizations have helped drive meaningful change in our community? In our state?
Yeah, it's you can't to exist as a silo. Everything is in partnerships. Your organization may be good at one thing. You need, in order to eliminate health disparities, you have to have other organizations that you can partner with.
Right.
For example, our organization members are nurses, pharmacists, healthcare practitioners, physicians, MDs, DOs, and they work at their respective locations. We partner with organizations so the example that I just gave, Evra Health and Baycare. We are having an event where if you don't have a doctor, or if you need access to preventive health care, or if you do a screening and you find out that you need further tests, you can have access to them. They can say, hey, we can put you in the system now, give you an appointment, follow up with you, get your information. So those partnerships are eliminating roadblocks and creating other opportunities for people to get into the healthcare system.
That's awesome. So with so many providers there, are you all doing mentorship at all with younger or older people that want to get into healthcare? Yes.
The beauty of the Minority Health Coalition of Pinellas is that we have been there. We have been there, and we have been at the the beginnings of wanting to be a provider and reaching out to people to, for your rotations or for your internships. And we know how hard it is, how competitive it is. And we also know that we need to give back. So I'll use your daughter as an example. So her daughter, she reached out to one of our providers. She's Dr. Shakara Wilson, who is the vice president of the Minority Health Coalition of Pinellas, and she's shadowing her. She's doing an internship, and she graduated from Tuskegee with pre-biology, pre-med. Now she's on her road to becoming a physician. And in order to do that, you have to shadow, you have to intern, you have to learn from somebody who has already done it. So we are happy to reach out to the young people. We need more physicians of color. Yes. That is a disparity itself. Yes. So we are absolutely 100% behind that push.
Thank you so much. And I'm so grateful for you all. So I wanted to ask you this question. In your role, yes, what role do pharmacists play and other healthcare professionals in advancing health equity, particularly in underserved communities?
You kind of brought up the situation with your dad earlier. Affordable medications is a big expense.
Yes.
No matter what organization you're in, the hospitals, for people to afford their medications, and some people have to make choices, hard choices, whether, hey, am I going to keep the lights on, or am I going to get my medication that I need to prevent me from having another cardiovascular event? Do I need to cut my pills in half to make them last a whole month? These are all stories that I know from being having a history as a community pharmacist. Mm-hmm. Those are hard decisions, and it's so I offer, or pharmacists offer, alternatives. It could be whether it's a generic medication, whether it's a medication that would do the same thing but is at a cheaper cost. You have assistance programs that your manufacturers, they offer. So like Lilly, they make a lot of different medications. And if you are of a certain household income, they will offer patient assistance where you may not pay anything. And all it requires is for you to download the application, fill it out, carry it to your doctor's office. Your doctor fills out that portion. You send it into the, in this case, Lilly, or to the manufacturer. And now you're able to get that 12-month supply of medication.
Wow.
You also have websites. Mm-hmm. GoodRx. You can do your own homework. So GoodRx is a website that's available to everyone. You type in GoodRx, and you put in your medication, you put in the supply, and it will populate all of the different prices of the pharmacies in your location and what it will cost you to get it filled. GoodRx has a coupon. So a lot of the pharmacies have savings plans. Mm-hmm. So even if you're going to a retailer and you don't have insurance, you ask the Walgreens pharmacist, the CVS pharmacist, hey, do you have a savings plan? You'll be surprised. Yes, typically all of your big retailers are going to have savings plans. So the formulary, they'll have a particular formulary where your medication might be on that savings plan. So typically where you might pay $20, $30 more, if they're on a savings plan, you're paying $5. So there are different options. Make sure that you ask the pharmacist. They're going to be your best resource for how to reduce your pocket cost.
Wow. And what Dr. Colquitt just explained is going to be on steroids at the event. So you're going to be able to get health screenings from all these specialists. If you see him, you might be able to talk to him, but come out to the event.
Yes.
The other thing I want to talk about, something that sometimes is a disparity in, that's knowledge. Like, can you talk a little bit about medication reconciliation, where you might be taking something that doesn't really it might clash, and then you don't know what to do. You're home and you're taking this medication, you gave grandma this and all of this, and it really doesn't go together because you might be trying to treat her headache, you might be trying to treat her high blood pressure, and then there's a clash. So what can we do? That's a disparity, like understanding what goes together, and you won't know that unless you have clinical knowledge. So
Yes.
what can someone do? What can we do in those situations?
Definitely ask questions. For individuals, we call it polypharmacy. When you have a lot of medications, when you have high blood, you're on 2 or 3 different high blood pressure medications. You're on 2 or 3 different diabetic medications, cholesterol, obesity, arthritis, mental health. So a person could be on all of these things, and all of these things may not mesh together, right? It can cause serious side effects. So that's one of my jobs is to make sure that when the community pharmacy that you go to is filling the medication, they're looking at all of that. And when they ask, do you have any questions? You ask that question. Just don't pick up your medicine and say, no, I don't have any questions. Like, hey, look, this is a new medication. Can you tell me how this is gonna work? Do I need to take it at a particular time? Because a lot of times it may just be spacing, spacing out the medications. Also, something that's vital is to tell your pharmacy if you're taking any over-the-counter medications or any natural drugs, because those over-the-counter, those natural medications that you get from the aisle, they can interfere with your prescription medications.
Yes.
So if they are not on file at your pharmacy, there's no way the computer can connect this and run that analysis if they're going to interact or not. So it's good to have a list of all your medications, your over-the-counter medications, your natural products that you're using, along with your prescription medications. And the last thing I want to say on that note is, because some people go to different pharmacies, it is extremely important to go to one pharmacy, because if you're getting this medication from that pharmacy and this one from another retailer that's not of the same, the computers are not talking to each other, and you could potentially be causing a major interaction.
That's so good. That's so much information. Another thing I want to address while I have you here.
Okay.
You don't often have doctors and pharmacists. I really want y'all to get this information.
Yes.
So how important is it for people, because I see this all the time, where you might be prescribed a medication and it's too high for you? I want you all to know that in our community, we have a voice, we have autonomy. You have, you can speak up at your physician's office, you can speak up at your specialist office. When you're not feeling well and you feel that medication is just overpowering you, how to have an autonomy of voice with your provider to say, hey, can you change my medication? Can you change the milligram, or can you speak to that?
I tell people all the time, you're your best advocate for, your body, and you know how your body reacts to certain things, and when something is going on with your body. I also counsel people to, when you're going to the doctor's office, don't be afraid. Go in with your list. Go in with your pre-written questions. They are there to help you with whatever situation that you have going on with your body. Do not be afraid. If a new medication is on board, doctor writes out a new medication, your body is feeling, it doesn't feel right. Now certain medications your body has to get used to.
Okay.
So it could be
different.
Right. It could be a natural occurrence, but you need to be counseled on that. So for instance, if you're a new blood pressure pill, it may regulate your body too fast and it drops your blood pressure too low. So you may think that's a side effect when actually it's not. That's the medication working and your body just has to get used to it. But if it's something that's really feeling, and that can require just a call, call back to the pharmacist. The pharmacist will tell you, what's going on with the medication and how your body's supposed to respond to it. Hey, give it a few days. You have certain medications, they may cause a side effect, may cause, hey, constipation, may cause diarrhea. You know, those are certain side effects of certain medications that you can't avoid. But if it's something that you cannot live with, you absolutely need to advocate for yourself. Your doctor will not know unless you say something. They can change a medication. They can, you can say, I don't like the way this feels. Hey, I tried to pick this up from the pharmacist. It costs too much. Can you change this?
Right.
You have that choice to do that.
You have a voice.
Yes, you do have a voice.
Now, I'm gonna ask it, y'all. I'm just gonna ask it now. He might be throwing up, but I'm gonna ask it.
Oh boy, look at you.
Let's talk about real quick.
Yes.
Weight loss medication.
Okay.
Weight loss medication is it Ozempic or versus exercising, taking weight loss medication? This is something I feel like is very prevalent in our community. I mean, many people are dealing with weight loss, instant weight loss. Can you talk about the healthy forms of this medication, or should we be exercising, or can we want to lose the 50 pounds for the summer body, but what are the health risks in that category? I had to ask it, y'all.
Yes.
Y'all know y'all want me to ask.
Yeah, weight loss, or as medically, they'll say obesity, you know, this is measured by BMI, body mass index, which is a screening that we're going to do at the African American Health Forum. The African American Health Forum, we promote holistic care. And with that, it's not only your preventive services, you know, that you do for your body by going to the doctor annually and things. We also want you to have healthy lifestyle of living, which is exercise. Supposed to be exercising. Guideline 150 minutes a week. What is that? What's 150 minutes a week? That's like 30 minutes, five days a week.
Yeah.
But you do as much as you can and work up to that as long as you are moving. So that lifestyle change, along with healthy eating, we will have a chef at the African American Health Forum that will be doing a food demonstration, and the food that we're serving at the African American Health Forum will be from our chef. So he will be there to tell you how to eat correctly, how to eat right. Now, if you do have to use a medication, there are medications that you can use. They're called GLP-1s. They're peptides. And that is the Ozempic, that is the Mounjaro, that is Zepbound. These medications are one injection, you know, subcutaneous right underneath the skin, once a week. And what they do is make you feel full. So they trick your body into thinking that it's not hungry. It makes you feel full, and you don't eat, and you lose a lot of weight. Or if you eat something, you're very full. It only takes a little bit. So that's why you see, like with the studies of some of these medications, you can lose 20 pounds, 24 pounds. I mean, not in a week now, but over several months, and so you drop a lot of weight in a short amount of time.
Wow.
But what is not said from the industry, it's in conjunction with healthy living, with exercise and healthy eating, because these drugs are not meant for a person to take constantly as a lifestyle, right? Because it shuts down your GI tract. By shutting down your GI tract, your GI tract is supposed to move. Like one of the side effects is constipation. Like people don't go to the bathroom because the muscles that are typically causing your bowel movements are now paralyzed. You know, so after being on this medication for a long time, that's something that could happen.
That's a side effect.
That could be, that's absolutely a long-term side effect, right? So it's not meant for long-term care. A lot of And the GLP-1s are causing an astronomical hike in healthcare cost. So insurances are moving away from covering them.
Wow.
So if you don't have diabetes, so they're not just covering them for obesity, right? If you don't have another disease state that you're right, a comorbidity such as diabetes is used for fatty liver, is used for sleep apnea, then they're not paying for it.
They're not paying for it.
Yeah. So you're gonna be out of pocket, and these drugs are very expensive. $1,000 for a month supply. Wow. $900 a month supply. Yes.
Wow. We're gonna have to just do the work.
You gotta do the work. Yeah. You gotta do the work. You do it at home.
So originally, were these drugs for that? They weren't originally for that, or were they for weight loss?
They're originally for diabetes.
For diabetes.
Yeah. So with the studies that came out, they especially for people who have cardiovascular issues, that's the drug of choice. If you have kidney disease or you need kidney protection, those drugs are primary. So originally for diabetes, and now, one of the, side or another effect, not a side effect, is the weight loss.
Okay, yeah. Thank you so much. I'm so glad I asked that for y'all. I know y'all want me to ask that.
But we want you to eat right, and we want you to go ahead and do the exercise. Now. All right. Yes.
All right.
Yes.
So so wrapping this up, thank you so much for all that valuable information. Yes. So if the listeners are interested in getting involved to eliminate health disparities with you all, how can they actively get involved?
First thing, you need to come to the African American Health Forum. It's going to be on April 18th at the Foundation for Healthy St. Pete, 34th Street South. Sorry, I don't have the exact address, but just look on our website, www.mhcpinellas.com. And from there, you can register. You can get all the information. We have all of our doctors listed on there. So if you don't even have a doctor, you go to our website. Everyone is there. If you need a specialist, everybody's there. If you need primary care, everybody's there. So we have our event on there. You can register on there. So it's a comprehensive website, and we update it regularly with news from the community and things that would be beneficial to the public.
That is so helpful, because a lot of times, sometimes we have an issue and then we want a provider of color, but we just stop looking. I know a lot of people who just stop looking because they couldn't find that specific person of color. You're working, you have things to do, you got your kids, so you just kind of forget about it. So it's so important that you come out on April 18th to the 20th anniversary. So what is going to be different about this one, the 20th anniversary?
You don't want to miss this one. This is the 20th. We've been around for 20 years. Just to have an organization, a Black organization that has been around for 20 years. Our founder is Dr. Kenneth Bryant. So through his vision, he's a urologist. He was treating people for prostate cancer. And then he formulated a prostate awareness group. And from that, it grew into this, from that seed, it grew into this, what we call all of these screenings. So from a health disparity with the prostate, Black men, to now we are addressing all of the disparities across the board, from the head to the feet. And it's 20 years, so it's a celebration.
20 years.
It's a celebration. We have so many providers coming out from Clearwater, Evra Health, they're in the healthcare systems, Evra Health, Orlando Health, Baycare. We have providers in private practice from Clearwater, from St. Pete. We have women doctors if you want a woman doctor. We have male doctors if you want a male doctor. Spanish doctors if you need a Spanish doctor. We are covering every person of color. And we are here to help the public. We are passionate. So the doctors that are there will take care of you Think about it. They're giving up their time on a Saturday to come to the 20th anniversary. You do not see your doctor out there doing that unless they're part of the minority health. I'm telling you, only the doctors that are part of the Minority Health Coalition will be there. If your doctor's not part of it, then probably they're out golfing or whatever they're doing. I don't know.
Yeah. So I do, if I'm not mistaken, now correct me if I'm wrong.
Yeah.
There's going to be a Q&A where you could go to the side and ask a question for some of these providers. Is it going to be something that, because some of y'all going to be like, look at this, look at this, look at this, look at this. So y'all going to be
So yeah, with our screenings, like for instance, our screenings, yeah, absolutely, we have privacy, right? So we will be utilizing rooms at the foundation that are put aside for certain screenings. You know, we have the gowns. They'll be there, so you'll get gowned up. You need to go to Dr. Thornton and get a skin screening. You will dress. You will be there, and you will be seen by a professional. Our vision, so vision and glaucoma. So we're doing both. If you need your eyes checked for vision, and if you need your eyes checked to see if you have glaucoma, we're doing that. Dr. John from Eyes on Central, he will be there. This is a fairly new, young African American doctor. He's my eye doctor. He keeps me in check. He will be there. So you can ask questions, and then we have all the doctors that are not doing screenings. They will be housed throughout the whole in our upward stream. You know, our circles for you to, if you have something that you was just sitting on your heart, and you're just out of your seat, and you always wanted to ask that doctor about this or whatever, they will be there to answer your questions. I mean, where can you go and get free information from all of these specialists and all of these doctors? There's nowhere else but the 20th anniversary on April 18th from 10 to 2. Nowhere else.
Yeah. So thank you so much, Dr. Colquitt, for being here. And you all are going to catch the replay. Last time you all caught the replay of, I guess you're going to catch the replay. And we're going to keep it up for the 18th and beyond, so you can get in touch with Dr. Colquitt and so many other providers that are going to help you eradicate, eliminate, or help you with life and health disparities in our community. So April 18th, again, what time?
April 18th, Foundation of Healthy St. Pete on 34th Street South. If you're familiar with St. Petersburg, you see churches. That's on the corner. Or if you see what's the Caribbean restaurant?
We got restaurants on every corner. We got churches on every corner.
Right.
Now we need to care about our health.
So in that same shopping center, from 10 to 2, you can come out and be a part of something fantastic at our 20th anniversary for the African American Health Forum. On
34th Street and 22nd Avenue, where the beauty supply store, y'all know what the beauty supply store is. It's right next door to the beauty supply store, the Foundations of a Healthy St.
What's the Caribbean restaurant there?
Is it
I can't remember.
Taste of the Islands?
Taste of the Islands? Yeah, Taste of the Isles. Taste of the Isles. Everyone has been to the Caribbean restaurant.
Yes.
Everyone has been to the beauty store.
Yes.
So that shopping center, that's where we're going to be at. Yes, please.
Okay. Well, thank you so much. Anything else you want to say to our listeners?
No, I just appreciate you having me on. It's always a pleasure wrapping it up with KK. Thank you. And hopefully, if your listeners need to get in contact with us, please do at www.mhcpinellas.com. And you can ask Dr. Colquitt a question when you see him at the please say you saw this on her podcast, and definitely, and I'll send you to our minority health table and we'll give you a gift. Oh, all right, y'all better see you there. Thank you so much. Thank you very much. Thank you so much. Bye.